Ontario's education system follows an inclusive model. This means that all students learn together in age-appropriate classes, no matter their academic needs. But students can fall behind academically for a variety of reasons, and researchers have observed the troublesome trend that those who have gaps in their learning in the primary years generally do not catch up. In fact, the gap tends to get wider as they fall further behind their peers. This has implications not only for students' academic success, but also on many other domains of their well-being. Long-standing research evidence is clear. The key to disrupting this trend is to improve early identification of students at risk and early intervention to provide appropriate supports. At the moment, each school or board has their own individual approach, but if we want to see change across the school system, we need to find a practical, scalable way to identify students requiring support as early as possible. In other words, we need a process-based social innovation. I propose a primary screener, which would be administered to all students 2 to 4 times a year, from kindergarten through to grade 2. This screener would assess a variety of indicators related to learning and academic achievement in order to catch any areas of difficulty early and inform the appropriate provision of supports. The screener must be quick and easy to administer, requiring no specialized training, so that it will be affordable and scalable. Supply teachers are ideally positioned to administer this screener. They are qualified members of the school boards who are available and seeking experience and opportunities in schools. To get this initiative off the ground, we would start with a pilot project in a few schools and then work to spread the innovation to all of Ontario's school boards. This would require a collaboration with the pilot school's principals to oversee the implementation in their schools, the Elementary Teachers Federation of Ontario to establish practices for working with supply teachers, and a researcher to help with the selection of an effective screener tool and to evaluate the impact of the project. Funding for the pilot may come from the Ministry of Education, the teachers' unions, or the nonprofit People for Education. However, through social return on investment, we would demonstrate the positive impacts of the screener to have the cost integrated into the annual school board operating budgets. Social return on investment would measure the improved academic, social, and emotional outcomes for individual students, the lower numbers of students being referred to special education services, the shorter wait times for psychoeducational assessments for those who need it, and the reduction in money spent on specialized equipment and technologies, such as speech-to-text software that help students compensate for learning gaps in the later years. Through this process-based social innovation, we are disrupting the current special education model, wherein students who don't fit the mold are singled out and labeled through diagnosis after having waited possibly years for a psychoeducational assessment, and where teachers feel overwhelmed by the so-called special treatment they need to give certain students. By disrupting this system, we get one step closer to universal design for learning, and we bring the education system one step closer to realizing the goal to reach every student.